Thank you for joining Politics and Media 101. Today we are airing part 2 of our discussion with Richard Helppie of the Common Bridge podcast and blog. In this part, Richard proposes an idea for universal health insurance, and he gives his perspective on U.S. partisan politics.
So, Rich, we just discussed guns, and you had a very thoughtful solution. Recently, there was the Inflation Reduction Act passed, which was a whole bunch of stuff. Part of it was healthcare. And I want to leave that aside, and I want to focus and get your opinions on what are some of the structural issues facing U.S. healthcare. Because if you're a U.S. citizen, you probably think our healthcare is broken. If you're a Republican, you had President Trump in the 2016 primary promising everybody, it sounded like socialized healthcare, but everybody was going to get healthcare. We weren't going to have people dying in the streets. Democrats believe the system is broken as well. And then if you're from another country, you look at America's system and you probably have a misconception that it's all privatized and you think it's very crazy. So understanding that, looking at our healthcare system, where do you see some of the biggest flaws? And then that would be opportunities. And we can rifle through these one by one.
Okay. Well, I've spent a lot of time in healthcare. I had over 7,000 healthcare clients during my career. I've read most of the legislation because it was part of the job that I had to do. And, I've been intimately involved with healthcare providers for a very, very long time. And that's both on the business side and then philanthropically. And again, our system needs reform. It needs simplification. What people need to bear in mind is this. Our healthcare providers are amazing. They perform miracles every day. We have amazing technology. We have amazing facilities. We have some of the best human beings I've ever encountered. And not only they're good-hearted and they're mission-oriented, but they're really well-trained and certified. Our hospitals are clean. Our doctors are trained. I mean, we do a lot of great things. Where we're broken is healthcare financing, which makes zero sense. And let me punctuate it this way. Had we not changed the payment system during the pandemic, just about every hospital in America would have gone broke. Think about that, because where hospitals get paid is on doing procedures. It is around volume, and people weren't going in to the hospitals because they didn't want to be around places that were overrun with COVID patients. Okay, so just about every health system would have gone under. We deal pretty well with our elderly, and I say pretty well because there are things always that can be improved. In fact, the recent legislation did that by capping the out-of-pockets for pharmaceuticals at $2,000. It keeps people that are on some of these like MS drugs that can be $65,000 that from going bankrupt, just facing something they just can't do. And we actually do a pretty good job on lower income. The Medicaid system, which was expanded in the Obamacare, the Patient Protection Affordable Care Act, where we raised what we described as poverty up and made it voluntary for states to join, and many did. So if you don't make enough money, you're doing pretty well. If you're old enough, you're doing pretty well. If you're a veteran, you can get care. It may not always be accessible. It may not always be the top quality. You may have some long waits, but you can get there. If you work for a large employer and you have what used to be called a traditional job, and the employer hasn't tried to carve that job up so that you're not called an employee, so they don't have to give you a health plan, then you have a health plan, unless you become too old or too ill to go to work, and then you lose your health benefits right at the time you need them the most. But let's say you're not any of those things. You don't belong to an employer-sponsored plan. You're not old enough for Medicare. You make too much money for Medicaid. You're not a veteran. Well, you're in the market now as a person, maybe you're a gig worker or a small business person, whatever. You might be spending, $8,000 a year for a premium that'll get you a $7,000 deductible. So you're coming out of pocket $15,000 before you even see the doctor one time or get one prescription filled. That's where we're broken. I can tell you chapter and verse the historical ways that we got here. I don't know that that is instructive as maybe looking forward. And the first step in my assessment, and by the way, I've tested this with dozens of people that are very knowledgeable about healthcare from all across the spectrum, from public health to not-for-profit hospitals to insurers to people that run medical practices and people that are somewhat libertarian. The first step, we have to realize that healthcare at a certain level is a public good. And a public good like a roadway, like a bridge, that everybody can use it, and we're going to have taxation in order to pay for that basic level, right? We spend a lot of money. Do you qualify for this plan? Did you get a better job? Do you make it too much? You're off of Medicaid. One question, are you a citizen or are you here legally? Okay, you get a base insurance, lots of ways to get there, expand the Medicaid further, lower Medicare. I know this is anathema to a lot of people on the right, but there's no other way to get that coverage.
But then from your perspective, the most powerful country, arguably one of the most wealthy countries, the largest, wealthiest country, if you combine those two, that healthcare should fundamentally be some sort of right for people that pay taxes.
Everybody gets it.
Everybody. It's a right in this country.
Yeah. Well, and again, I don't want to get into what is a right or what is enacted by law, because that's walking a legal construct. I'm just saying, as a common sense basis, okay, it needs to be a public good like a road. And we don't say, this guy is too impoverished to walk on our sidewalk or drive on our road, but this guy that's done a little better gets to be on the road. Okay, we all need to be on the road. We all need to have a basic level of healthcare services. It's easily defined so that there is a base level of care. And when I talk about taxation, the ways to pay for it, I mean, you could do it right off the 1040, all right, that, it's a percentage of income on a sliding scale. That's how Medicare Part B is paid for. It's a sliding scale based on income. You could go into the payroll system that right now the employer pays half the Medicare and the employee pays the other half. You just adjust those rates. Those are ways to get there so that you can fund a decent level of care. Now, I would also advocate that we would have a secondary private market for supplemental insurance so that people that have the desire and they have the means to pay for more choice, broader access, alternative treatments, they should be able to go out and buy that. But the one stipulation I'd put on this is that if an employer provides that insurance, it's taxable because it's compensation. And we need that private market to kind of foster innovation. And if you look around the world, nearly every country that has a universal system, they have a secondary market as well. And it generally works pretty well that way.
Let's talk about how big each of those markets should be. There are lots of countries that have like a mixed market healthcare system, just like you've described, that the US should have. I mean, we already do to a very large extent because of programs like Medicare and Medicaid. So the question then kind of becomes, to have a healthy balance, how many people should be in each market? Do we want to move more people into the private market? Do we want to move more people into the public market? Do we expect that if there was a public option, that so many people would choose it, that the private insurers couldn't really compete in the market? Where do we think the balance should be?
Let me try to clarify a little bit. The base system, everybody gets it. So just like when you turn 65 years old, you get Medicare Part A. Okay, whether you want it or not, whether you got anything else or not, you get it. All right. And so we're not going to exclude anybody from that pool. And so the things that happen, the broken bones, the cancer treatments, and I would extend it to wellness checks and preventive medicine and healthcare screening, mental health screenings and so forth, that's in that base level, and that's funded through taxation. Now, most of these universal systems, they manage the budget by restricting access, okay, or limiting what options are available. So if somebody wants to avail themselves of another market, then there would be a private market that they would pay for out of pocket. They would not leave the public system. I don't think there's a way to set that other than based on demand.
So I understand now. So the private market would be only supplementary. It would be only a secondary market, and everyone would be automatically enrolled in the baseline insurance program. So this is, in a way, an even more kind of progressive system than the system in a place like Germany or the Netherlands, where it's a little bit more like what was advocated by Senator Sanders than what was advocated by President Biden in the primary or some of the others.
Buttigieg and those guys.
Yeah, the public option system.
Yeah. And by the way, I have a great admiration for Bernie Sanders. I was a supporter of him when he was going to be the president because I thought not necessarily that all his solutions were right, but I liked the agenda that he had. And I think he's an effective politician. I know that's probably going to annoy some of my listeners and yours, but that's the way I look at him. But his view, and a lot of the people on the far left think they're going to outlaw any treatment outside of the universal system. And there's legislation that's been tried. The Clinton Care Bill in the early 90s was really relying on the Justice Department and prosecution to try to control that. I think if you make that system, just like Medicaid, good, it's going to be less demand for that private layer because people are going to look at that and say, do I really want to come out of pocket to buy more insurance? I think I can be good with what we've got. That private market then will have to actually be a private market. So instead of being this subsidized tax, incredibly unfair tax-free system that they can cut you off as soon as you start making claims, they're going to have to define a relevant product and sell it to people to say you need this above and beyond and articulate a value proposition.
So, Rich, it sounds like to me then you're advocating for a very high quality universal system and then the private system. Now, help me understand what this private system would look like. Is this a private system where you buy into it because you have the means and something that you could get out of it would be like innovative cancer drugs, where basically these drugs would be cordoned off. They would not be available to the general public, and there'd be a tier of medication for all sorts of illnesses. And then taking that a step further, if you wanted to go see the doctor that comes to my mind is James Andrews, who's a famous physician for baseball players. But this is basically to say that the private tier would derive value from innovative treatments and then truly the best doctors in the region or the state or the locality. Is that what we're looking at? Or how would the private sector tier derive that value to actually have people pay into it to be able to fund itself?
Well, those would be ways to do that. Now, in many of the universal systems, to keep your licensure, you need to see a certain percentage of patients from the universal system. So could a doctor be entirely outside of the system? That would be kind of one of those devil in the details. And there's that could consume an entire podcast about the pros and cons of doing that. We do have those examples in our system today for certain specialties where they don't take insurance and it's cash basis and so forth. A couple other elements too before we get here. I would promote the use of health savings accounts for everybody, not just employer sponsored, so that everybody could defer some of their earnings for future healthcare related expenses. It grows just like an IRA does, and that it can be applied toward long-term care and assisted living. Because oftentimes people get to the end of their lives, they need more care, and there's no place to go. And the two other elements one that I've said, and I'm going to end on that, and as I think a real linchpin, But also, I'd make everybody immediately eligible for Medicare Part D. That's the plan for prescription drug coverage. It's working well. There's high subscriber satisfaction. It's coming in below budget. And I look at it, Part D is a fair fight. You're pitting the two big behemoths in healthcare, the for-profit insurance industry against the for-profit big pharma. It's an absolutely fair fight, and it's kind of working out pretty well. But the other thing, the linchpin to all of this is that we need to end the tax-favored treatment of employer-sponsored health plans. And if we did one thing, change that would start the whole system. All right. So, if I live next door to you and you have a great plan that pays for everything, first dollar coverage and a big broad network, and I've got a little thin plan that I've got to go to, a doctor that's 40 miles away and I've got big deductibles, you pay zero income tax on that provided by your employer. I pay zero. It's compensation. The only reason we don't tax it is because of wage controls in the 1940s and said, all right, you can't raise people's wages, but you can give them fringe benefits at no cost. And that's what lit this fire.
So, Rich, I've got a question for you that's coming from sort of a devil's advocacy perspective here. We're talking about a system that would have...
How surprising, John.
Indeed. It will be a different angle than on our previous discussion, I think, politically. We're talking about a system that would have automatic enrollment. And Rich, you acknowledged how difficult it would be for private insurers to take on a new role offering supplementary, secondary insurance and, offer a compelling product that would keep them in a good standing on a for-profit basis. There's this whole idea of path dependency and how we have such a strong status quo bias because we're afraid of disruption. We know that the healthcare sector is such a massive part of our economy. You hear that it's 1/6 or 1/5 of our entire GDP quite often. And if we talk about a system that has automatic enrollment, we're talking about really overhauling the entire commercial structure of the current health industry. Of course, we are doing this while recognizing that the priority has to be with the factors that you've outlined, that human health and safety, and we were talking about safety before, now we're talking about health, matter more than these commercial industries. But with an industry that's of that size, we also have to think about the economic disruption that would occur. And we have to try to manage the fallout. As someone who knows the for-profit commercial health industry so well, what is your thinking about all of that?
Well, we're more than halfway there. When you look at the enrollment numbers of Medicaid CHIP, which is part of Medicaid, and Medicare, and you throw in the VA and you throw in TRICARE for veterans that don't live near a facility, we're already more than halfway there. So the argument from the commercial insurance companies are, hey, we're a very efficient market. But again, as I've said, yeah, but it's a false market because number one, you're subsidized. Your product is being subsidized by the taxpayer. Number two, it's cruel. You're thrown out if you become too ill or too old to work. And where do you go when you become too ill or too old to work? You go into Medicaid or Medicare or both and become dual eligible. So we're already more than halfway there. And also, frankly, I'll tell you what, as an employer, and I bought a lot of health plans that you work really hard to get something. But then if you have, claims, you're just going to pay for it again the next year. And, I had a workforce that was, across the country. And so there were different needs in different places. It was really hard to find something that would work for everybody. And as an employer, I can tell you a lot of employers would breathe a sigh of relief if they didn't have to go through that anymore and could just, it could be a taxation, replace all this cost that they're accruing in healthcare and let that national system do that. And then look, if you're Blue Cross, you're going to come up with a way to design an insurance product. And if you can't, which you probably can't, you're going to shrink. You were thriving under a different economic and social environment that has long since passed. Every industry comes and goes. Look at how few car companies we have left in the country. Okay, look at the consolidation around technology. It's not going to be a bad thing to get more people covered. And also, John, one of the really, really big things in healthcare, we all know today that a lot of the cost in healthcare is driven by wellness or inattentive to wellness, all right, or not managing chronic care. But the incentives in that commercial sector is all about just treating illness, or if you can get away with it, not treating the illness, because your average person is going to change their health plan because they change employers, or the employer shops the plan, or the employer changes the plan. So here's what I haven't done this lately, but you guys could try this with your friends and family. Ask people who insures their automobiles. Ask them how long they've been with that automobile carrier. Then ask them during that time, how many different health insurance plans have you had? So if you think about that commercial market, I'm not trying to make this commercial, but I'll just say that my entire married life, we've been with State Farm. Okay. We've paid premiums into State Farm. We've had some claims at State Farm. Okay. So State Farm, they get our premium. They have time to invest that premium in anticipation of claims. We made a few claims. Okay. We had 4 teenage drivers at one time. Okay. They all hit something at one point. And State Farm knew if they serviced that claim, there was a premium stream coming on the other side of it. So they wanted us to be happy with what we got. And they did. And here we are still with a lot fewer claims these days. Now contrast that with a health plan that has you for a year. There's not a premium stream you can invest because you don't have time. You get a claim, really doesn't matter that much how well you service that claim because you're probably not going to have that subscriber the next year, odds are. All right. So a lot of your machinery is set up to say, oh, you didn't code this right, or you did this imaging out of sequence. Oh, we don't pay for this at this facility, but we pay for it at that facility. And all the system is set up to not cover you. That's where all the incentives are. So I think if people were more aware of what they didn't have, they'd be a lot more willing to give that up for something that they could actually have some coverage with.
Yeah, and this is just to get into what you're saying or reference what you're saying. There's, for our listeners, some folks have to go through prior authorization, which is the insurance company, essentially, my layman's understanding, the insurance company essentially dictating the treatment that you're going to get, really regardless of what your physician or doctor thinks is best.
That's true of all insurances. Okay, the pre-authorization, like you can't walk in any place, I don't care what your card you're carrying, and say, I think I want an MRI in my head. Okay, you that's not how it works. You've got to go through the X-ray, the CAT scan. Okay, now we're going to do the MRI. All right, so they're always pre-authorization, and there's been policies or proposals, I should say, about making a universal medical necessity for rulings like that to separate the economic incentive to deny the claim from what the medical necessity might be. But there's always going to be pre-authorizations. That's just part of it. Otherwise, you have people that they'll just do everything no matter what.
Yeah, I think the problem with the healthcare prior authorizations is that right now, the way it's set up, from my understanding, is that it's primarily financially based, not based on treatments. And specifically 2 weeks ago, there was a bill that passed the House. So it got out of Ways and Means, bipartisan piece of legislation that is actually reforming. If it passes the Senate, it would reform the prior authorization process in healthcare, because healthcare, again, a human being is more valuable than a TV or a car, to change it to be a medical review board. So you're going to actually have whether it's physicians or people that are just educated on the topics, be the people that ultimately determine, can I get this medication? It's going to reform the system in a way that is a good thing. But I want to pivot. So we're talking about expanding coverage, giving people more coverage. Right now, we have a physician shortage, especially mental health shortage, but physicians of all stripes. And then COVID wreaked havoc. One of my former roommates, she's a nurse. It wreaked havoc on their profession. Folks were retiring early. They were trying to bring them back. So that is to say, it feels like in our current system, maybe not so much in urban areas, but definitely in rural areas, there aren't enough physicians. There aren't enough cardiologists. There aren't enough specialists. So if we're going to add more people to this system, I'm sure you've given this thought, and it's just something that popped into my mind as we're talking about this. I'm not saying we can't do it because we don't have enough physicians. I'm asking you, how do we get more? Like what type of, how do we change the process of becoming a physician or incentivize it without increasing the salaries maybe, because then wouldn't that be too much of a burden on the public?
I'm going to explain this as quickly as I can. So first of all, there's already burden on the care system, right? That it's just really hard to get paid. So, and a lot of times we're spending inefficiently because, somebody that doesn't treat their diabetes ends up in the ER and it costs a lot of money and it takes a lot of doctors and nurses, medications and a bed to get them right. So our spend is not only too high, it's not very effective. During the Clinton administration, they cut graduate medical education out of the reimbursement model. Okay. And that's to slow down the provision of doctors. And one of the things to remember is that when you're looking at this from the federal budget perspective, it's all about, can we bring down cost? Okay. And there's only 4 elements to cost. It's how many people are there, times how long do they live, times how much stuff can we do to them, times how often do we do it. So when you start cutting the supply of providers, you start reducing the number of things that can be done and how frequently it can be done. Okay. And now we're probably coming to the end of that cycle. What can we do? So one of the things to expand to leverage the time of providers is telemedicine, that more people can be seen. The other thing would be letting people work at the top of their license, that they're able to do more things from the medical assistants and the physician assistants. And the information systems are still pretty bad, but they're better now for having a team coverage versus this is the doctor that knows me. And you can see more continuity of care. Also, under the type of system I'm talking about, that there's clearly incentives for wellness and prevention, because that all of us are going to be in that system for a long time, not 1 year. So if we, manage our diet and get exercise and manage any genetic or chronic conditions we have, we're going to be less impactful on that acute care system. Okay, theoretically. And by the way, if we ran into another pandemic, the benefits could be adjusted to reflect that that's where we need to go for the coverage. It's nothing that we've got today makes any sense. And again, if you look also during the pandemic, it's talked about the hospitals going bankrupt at a time when a lot of people were getting sick. Guess who was making money hand over fist?
John and I may or may not have been discussing that before the show.
Absolutely. Why? Because nobody was getting care. So we had to get rebates from that under political pressure, and there's an aspect of the Affordable Care Act called the medical loss ratio, and that so you can't charge premiums unless you're paying it out for medical care. But don't get me started about pharmacy benefit managers and how that's being used to navigate around that, because that could be another hour on that. We can be rational about our system in a much better way, and also it's facing the reality. So again, 4 elements of consolidating all the tax-supported plans down to 1, allowing a secondary private market, but not with the crazy tax favor treatment it gets, promote the use of health savings accounts for everybody, and make everybody immediately eligible for Medicare Part D.
So, Rich, throughout this discussion of this issue, we've really gotten the sense that you're quite a policy-focused gentleman yourself, and you're really looking at the detail of this, especially this topic, but you've taken a policy-first approach to your government analysis. It's interesting as we're heading into this upcoming election that's going to determine certainly the next 2 years, if not more, of the American policy landscape, that a lot of the media coverage is rather personality focused and campaign focused, unfortunately. Rich, just this week, the Republicans on the House side put forward a platform that they're calling the Commitment to America. It's obviously a throwback to the Contract for America back in the early 1990s. I'm, without any expectation that you've taken a look at the document, at least we have some idea of where these two parties are hoping to go policy-wise ahead of the November vote. So, Rich, can you tell us who you're impressed by? And if we can ask very modestly and politely, even if you would tip your hand on how you'll fill in your ballot.
Well, let me say the first thing about policy, in that my career was begun as a software engineer, or as called ourselves programmers back then. And so always, what are we trying to do? How does it work? Are we fixing the real problem? And that was my business career. And anytime I'd go in and look at a business, my first question was, why does this company need to exist? Okay, what problem is it solving? What societal good is it doing? Why do we need to have this in the first place? And so I tend to look at things in a systematic and I hope left brain logical way to look at that. And I see what we're doing on the political front as anything but logic. And I think there's a number of culprits in there. And at the top of the list, obviously, it's the two major parties. They only want to say the other people are so bad and so scary that you should vote for us, which I think is nuts. And then, of course, it's this crazy news media that isn't really news. It's news as entertainment. And to make money, they get a smaller and smaller slice of the audience and keep pounding them with things that they think will reinforce the inflamed nature of that audience. In fact, this past week on my Common Bridge Substack, I wrote a column, and I just recorded for release tomorrow, which will be September 27th, about my impressions of running the Common Bridge for 3 years and how bad the media model is today and how little real information there is in the public discourse. And I can go back to the presidential election in 1960, where it was a very tightly, very highly competitive and very tight race between Richard Nixon and John Kennedy. Both men eminently qualified to be the president, and neither could get nominated by their own party today. Richard Nixon set up the EPA. Richard Nixon was in favor of health maintenance organizations. John Kennedy was a tax cutter and a military hawk. They couldn't find a spot in their current place. The Republicans, I look at them as the deer in the headlights party. I look for it and I can't find what the definition is. And they're stuck with, what do we do about Donald Trump? And instead of doing something about it, they want someone else. And my advice to the Republicans, and I wrote a column about this, was they need to push Trump over the edge. And what's going to happen is Trump's going to yell at him, and he's going to disparage him. And so what? Then it's going to be over. And he's going to do that anyway. And I think his influence is exaggerated because he seems to have a pattern of picking the people that are in the lead and saying, yeah, that's who I'm endorsing. And look, my endorsed candidates won. And I mean, the man's not electable, and I'm not even weighing in on the so-called investigations. I'm just looking at the guy's behavior as an executive. And this is something that I actually went to a lot of executives, and a lot of us have been on search committees for chief executives. And we actually said in the last two cycles, if we would have gotten the finalists we got in 16 and the finalists we got in 2020, unanimously people said, yeah, we would have told the search firm, bring us more candidates. So that's where the Republicans are today. And the Republicans are hoping that people are going to look at things like inflation. They're going to look at some of the cultural wars, things like what's happening at local school boards, and they're going to hope to ride that to a turn in the House, probably not the Senate. Okay, that's my look at the Republicans, and the Democrats. Okay, don't seem to be able to get anything that approaches common sense, and they keep going down further and further radical paths. I mean, to the point of absurdity, where a nominee for the Supreme Court had to pretend that she didn't know what a woman is. I mean, it's the theater of the absurd. And then we get the speech that President Biden made, or President Unity, as I like to call him, in Philadelphia, where he goes out and he slams this segment of the population. Although I have to give them, the MAGA people are very dedicated, because have you guys ever been in a polar vortex?
No, I have not.
Okay, it's really cold. Okay, but the MAGA guys were so intent on tracking down people they didn't like, right in the dead of night in Chicago. They hid to attack a guy just trying to buy a tuna fish sandwich at 2 a.m. That's the guys that our president thinks are the problem. I think the bigger issue we have is that incumbents aren't being held accountable. We're not getting good behavior. They run for re-election and say that other guy coming is a lot scarier. That's how they want to continue to be in power and govern.
Well, Rich, I think that one of the points you made early on there was very well taken. It's one that I often put forward myself, which is that it is very strange that the Republicans seem to be in such fear and awe of Donald Trump's supposed political prowess when he had the very rare feat of losing a trajectory a trifecta with just a few years. He lost them a majority in the House, the U.S. Senate, and the White House very quickly, and under circumstances that you think would favor incumbents, with a quite strong economy and with the pandemic. At that point in the pandemic trajectory, most incumbents were getting a popularity boost, as we saw in other countries. And it does seem as though they're beginning to recognize the futility of his political offering. Certainly the U.S. Senate races in Georgia that had a runoff after the 2020 election, when his position in those races really seemed to harm the Republicans' path to victory. And then again, in this cycle, when he encouraged voters to nominate a number of candidates in U.S. Senate races that are not faring very well in the general election climate. But we are, again, even though we're offering polemics about the way the media talk about these things, we're engaging in it a little bit ourselves. We're talking about, comments that were made by the Supreme Court nominee as an explanation for a radical path. And we're also talking generally about Trump's behavior and fitness as a major factor, appropriately, and how we look at his qualification to serve. Rich, I did kind of want to provoke you a bit on that policy front. I mean, you mentioned that the Republicans are hoping that complaints about inflation will help them electorally, and I think that they absolutely do. But I'm wondering if you've really seen anything from them as far as a solution, whether they've really proposed anything that would address the problem. And then, as we look at the Democrats, I mean, you said that they're heading down a radical path and searching for things that are not commonsensical. But I wonder if that is partly based on, some of those comments that you referred to, or if it's really based on a strict reading of the legislative achievements of the last 2 years.
A great question, first of all. So the Republicans didn't feel like they had to come up with anything. that they thought there was enough things going wrong. They could point over at the economy, the schools, the cultural issues, and say, we're not that. We're going to save you from that. And that was pretty much the shtick they were running on. The Democrats, who probably need Trump more than the Republicans do, were pointing over and saying that's the party of Trump. And I recall a day when we actually had a press that would hold the incumbents accountable. So let me give you a great example. We're probably here in the state of Michigan going to have reelected our incumbent governor. But this incumbent governor, to me, was an absolute failure of leadership, in that there were orders during the pandemic, don't go to Florida. I personally know people whose elderly relatives died in nursing homes without a hug because of this governor's orders. Telling kids don't go to spring break. And this governor leaves the state, goes to Florida, where her kids also travel, to visit her father, when the only right answer would have been, sorry, Dad, I just told 10 million people not to do this. I can't. And that, to me, and that you can't find that in the news. And that's not the only violation of the COVID restrictions that she herself put in place that she just blithely ignored. And you can't get that out. So that, to me, is the biggest failing, is that we need to hold the incumbents accountable. They need to fear the press. They need to fear the voters. And that's where I don't think they do.
But we still need to think pragmatically about the alternatives. I mean, we have a first past the post system. We have a two-party system. So we want to hold incumbents accountable. Of course, I can't imagine anyone would disagree with that. But the other factor is equally important.
Well, the thing is about a two-party system, it's not necessarily a two-party system. I know there's been a lot of work the Republicans and Democrats have done together to try to limit other parties, from ballot access to the way that the campaigns are structured. But I've got a gentleman that will be on the first two episodes of my fourth season in the beginning of October, talking about ranked choice voting and what's the results that we've seen in the early goings of ranked choice voting. Ranked choice voting combined maybe with an open primary, that we should start to get more diversity of thought and maybe more coalescing versus the current primary system we've got. You get the most extreme in each party, and then it really is this awful lesser of two evils. I had a gentleman on my show talk about proportional representation, and there's a guest I'm chasing that's talking about the need for 6 political parties, and the needs to that the two parties that we have today really can't speak to the diversity of political thought that we have. And in fact, I've seen this on this interview. If I said A, there was this both of you said, oh, well, that must mean you mean B, C, D, E, F, G. No. I don't mean any of those things. I mean A as this. So this is what we need to break out of, is this binary thought process around politics. I mean, it's just not a binary world. And, and people, based on their ethnic origin, all don't think the same.
I personally support ranked choice voting and open primaries. A problem, and so do Democrats. The problem is the Republicans don't. So ranked choice voting in Alaska just recently prevented Sarah Palin from becoming a member in a special election. And as a result of that, you had Senator Tom Cotton, who I don't think is a Trumper, come out and say, quote unquote, ranked choice voting is a scam to rig elections.
Let me just stop you right there. Okay. The person that cost Sarah Palin, that was Sarah Palin, because in the first go round, Mary, I don't want to mispronounce her name, Peltola, she got 77,000 votes, and the two combined Republicans, Palin and Begich, got 115,000 votes. So through one lens, it's like 115,000 to 77,000. But Palin was second by 65-ish thousand. So Palin told people, don't put in a second choice. So since there was not 50% on the first ballot, Begich was eliminated. and his voters added 13,000 to the ultimate winner and twice that number, over 25,000 to Palin. But that gap of people that didn't make a second choice was the difference in the election. All right. And it almost reminded me of Donald Trump in 2020 saying, hey, don't mail your ballot. Don't, use absentee ballot. That's bad. May have cost him the election. So I think it's one data point, and I'm less concerned about who the rep from Alaska is than I am about, okay, what's she going to do when she gets there? Because no matter who we elect, when they get to Washington, Kevin McCarthy's there, okay, Nancy Pelosi's there, Chuck Schumer's there, Mitch McConnell's there. They control the committee assignments. They control the cash for reelection campaigns. And it shouldn't be you're a Democrat or a Republican, therefore you should vote this. You should be representing the people that you come from, right? And we used to have liberal Republicans. We used to have conservative Democrats. And maybe, I don't know how it's going to work. We're all going to have to wait to see how this plays out. But we need to do something other than the primary system and the, lesser of two evils general.
John asked about policy prescriptions for the Republican Party and what you may like. You went to ranked choice voting, and you have Senator Cotton saying ranked choice voting is a scam because of what happened in Alaska. Then you have the press secretary of the Republican National Committee, so literally the Republican Party, saying our Republican nominee earned nearly 60% of Alaskans' votes on the ballot, and now every single one of those voters lost their voice to choose their representative in Congress. Alaskans deserve an equal and fair process. Two things this special election were not. So that is to say, the Republican Party opposes the policy prescription that you just presented. So is there anything policy-wise, as opposed to running against something like you had mentioned earlier, that you think for inflation or any serious issues that endear you to the Republican Party?
No, and that's why I'm an independent and fiercely nonpartisan. And I have supported Republicans, Democrats, independents. And, on the ranked choice voting, a great case study would have been the 1992 presidential election, when Ross Perot won enough votes to turn the electoral votes in like New York and California. It would have been really interesting to see what would have happened if it would have been eliminate Perot as the third player and see where his votes got divided. It's academic, obviously, but I just think we need to do something different, because the vast majority of people I talk to aren't like in the tank for the Democrats or in the tank for the Republicans. They just want a better government. They want to feel like they're represented. They want to be able to pick up news and feel like they're not being played by a narrative. Okay. And we got to get off this binary blue versus red, because it's not serving us very well. We've talked about healthcare. We've talked about guns. Maybe we're making some progress on student debt. We'll see if it holds up. We just aren't doing a great job in this divided, hyper partisan shit show that we have right now. And I wrote this column on September 24th about that. So I think we need to get better people in behaving better, and we need to reward politicians for working both sides. And one of you mentioned the contract with America in 1994. If you remember what happened after that, Bill Clinton, who ran as a centrist, a third way, said, okay, Newt Gingrich, Speaker of the House, we're going to sit down and figure out how to do this. Okay. Got the, Tip O'Neill and Ronald Reagan as a model. And now I've seen the last several presidential cycles. I don't know that Barack Obama ever invited John Boehner up to Camp David for a talk, or even to the Oval Office. And, Lord knows what Trump did. It just seems like whoever paid him a compliment was the fair-haired person for the day. But we need to do a better job of expecting those people that we elect to forget the election and actually do the work after.
Real quick though. President Obama did invite John Boehner in 2011 to Camp David, and John Boehner said, don't bother. And President Obama also did actually take John Boehner on a flight to Air Force One. So I think that the real breakdown of and as you remember, the Affordable Care Act went through the normal committee process, which we've completely lost touch of. I think that ultimately the true breakdown happened during President Obama's time in the White House when he was making these overtures. The Republicans and Mitch McConnell is infamously quoted as saying, my top priority in 2010 is preventing a second term for President Obama. It wasn't any piece of legislation. It was really truly the obstructionism that came out there. So I did just want to make that note.
Yeah, you're right. And McConnell made that quote in October after 10 months of being frustrated. And I think that the results in the midterm, the shellacking, kind of proved that where the electorate was. But again, it still comes down to, I don't give a rat's butt whether you want to blame the Republicans or the Democrats. It doesn't matter. They're just not getting work done. And I don't think anybody can make a case that, hey, if we just eliminate the other side, everything's going to be great. Because you can point to California that I spent a considerable amount of time in and just recently left my seasonal residence there. It's in really bad shape. It's been a one-party state for a long time. I think we need to hold people accountable for what they're actually producing. And we need to be conscious of how they're handling power and whether they're serving us or whether they're serving a party. And I don't care, again, which party they need to be doing the work.
I agree with you about the ranked choice voting aspect of this. So that could be something that might improve the crop of candidates that make it through an election. Proportional representation, I'm a bit more skeptical that it would make an enormous difference, frankly. I mean, we can observe countries that have a proportional representation system and recognize how difficult it is to govern there and how adversarial they are. And Italy, which has been in the news all day today because of their recent election, is an excellent example. And with that in mind, I think that you're offering a bit of a mixed appeal here, Rich, because on one hand, it seems as though what you're really hoping for the most is that politics will become non-adversarial. And that's impossible.
No, but I love you use the term mixed. All right, because it's the antithesis of binary. And what I'm asking for is accountability. I'm asking for the people that have the power to deal with the issues of the day, with healthcare, with guns, with student debt, with economic opportunity, with a reasonable plan that tells a young person, here's how you get on the first rung of homeownership. Here's how you can build a career and build a middle-class standard of living. And those things aren't being addressed. And by trying to put people into categories based on their ancestral heritage or their gender, or to say, well, that's a red state or a blue state, I mean, it's exhausting and it doesn't lead any place. And we need way more find places to agree than find places to defeat the other one. And when I hear that, well, it's mixed. Yeah, it's not binary. It's not red. It's not blue. And I mean, I hate that color. When I cheer for the Detroit Red Wings, I'm all in for the Red Wings, period. But they're not. This is not the Detroit Red Wings. This is the United States of America.
Maybe you didn't know exactly where I was going this when I said that it was a mixed appeal. What I meant to say was that some of the qualities that it sounds like you're looking for paint a little bit of a mixed picture here, because on one hand, it seems though what you really dislike the most is this adversarial nature of our politics. I don't think we can ever really expect that could go away. And in situations where even if there's adversarial aspects of the political culture, one party continues to win consistently. You've also said that, where there isn't real competition between the parties, that's unhelpful. You pointed out California. I mean, we could also look at like in the UK, where they've had 12 years of one party in power and things are just going increasingly off the rails. What I am wondering, Rich, if it's really not the adversarial aspect of politics that is the biggest problem here if we're talking about the inability to accomplish things, to get things done, to address big problems. I'm wondering if it might be how in the U.S. political system, there are so many roadblocks to achieving legislative outcomes. For a bill to go through all the steps to become law, it's a very complicated and difficult process, isn't it? And that's partly because of the way that we've structured our legislative system at the national level, right? We have bicameralism, and we also have a presidential system. So power is really divided three ways. And any of those different components of the government can disrupt the passage of a bill. You need three different components to align. That's why we talk about trifectas. That is very different from a place like the UK, where you can achieve something with the parliamentary majority that you have. Another aspect of this is the way that the courts have recently been interpreting the legislative text and the Constitution in a way that's very strange and does not allow the government to pursue the policy goals that it's decided on. And another thing that's received quite a bit of attention lately are just strange, baroque, and obscure elements of legislative rules. And the most notable of those would be 60-vote cloture, which people call the filibuster all the time in the media conversation about this topic. But it's really just a rule that says that to get cloture on a vote, to move past the question, you need to have 60 out of 100 votes in a Senate system that tends to be divided on more narrow lines than that. Perhaps it's some of these aspects that are really the biggest issues if we're talking about our inability to address problems.
Let me just comment like this. So first of all, the barrier we have is we can't incent people for compromise. Look, recently that CNN said they were going to go back and start reporting news. And I watched my Twitter feed blow up with people saying, well, I'm never going to watch them again. I'm only going to go to MSNBC. So I don't know if it's the politicians driving the split or if it's the media or what, but we have to get to a place where we can get statecraft back and that there can be compromise and that, yeah, there's always going to be diversity of opinion. And we don't need to be divided on party lines. It shouldn't be, if we have a 50-50 Senate, that's the way the votes come out. We should be dealing with more statecraft to say that we got 60 because we got, 40 Republicans and 20 Democrats. That's how we got to that end point. I am troubled by a lot of what I see on the judiciary, but from a little bit different take, is that we've given into this thing called trials by media, and conclusions are reached. And really, it takes on, like, if there's a prosecution that comes on, if you ever watched a trial, you'll see that when the prosecution gets done, you think, boy, this person's really guilty. Well, then the defense comes on and says, well, here's some things that were left out, and here's some other angles. And you go, well, maybe it's not as black and white as that. What I see really dangerous right now is that you've got a lot of these pundits that are, they're basically prostituted themselves for a cable news spot. They're very predictable. You know what they're going to say. They're paid, and frankly, they're pathetic. They're going to conduct trial in the media, and then when they lose in actual court, they attack the judge, the jury, whatever. They question the integrity of the Supreme Court and so forth. It's nonsense. We don't talk about the substance of what the varying opinions might be and where the compromises might be found. And that's what we need to get back to. We're not all going to be the same, but we can find places to agree.
Thank you for listening to this conversation. On Thursday, we bring you our discussion with Colonel Mark Cancian of CSIS and Johns Hopkins University. Colonel Cancian helps us understand the state of play in the Ukraine war and helps us evaluate the effectiveness of U.S. support for Ukraine. It's a great conversation, and I hope you'll join us then.